My name's Emma Fauss, and I'm the CEO of Medical Informatics Corp. Medical Informatics is a company that improves clinical surveillance and provides predictive analytics in hospitals around the country. One of the challenges hospitals around the country face is that they spend a lot of money on patient monitoring equipment for inpatient care, which is supposed to provide continuous surveillance. And what happens is that you can have up to 800,000 data elements being generated on these patients every hour, yet only 6 of those go to the EHR to sort of record what's happened to that patient. And so you end up having gaps in information, gaps in documentation that impact the way patients are treated. And so what Medical Informatics has really done is we've looked at a way to help capture that data and turn it into ways that you can both visualize it in the existing clinical workflows as well as deploy at scale patient-centered analytics. The first thing we do is just provide data access, right? Providing that data access to that rich, high-fidelity data from across the different medical devices really can move the needle in terms of improving patient care and improving clinical documentation or reducing sort of that burden on the clinical team. The second thing we do is really allow institutions to leverage that data, right? So it's not just about having the data in some warehouse, but it's about the ability to deploy real-time analytics, operationalize them at scale across thousands of beds, hundreds of facilities. I have a perfect example how we're changing clinical care. A patient had unfortunately coded in the ICU. And what most people don't realize is that the monitoring equipment today in most of these hospitals, if you move a patient from one care area to another, all that data gets erased. So this physician and code team was in the OR asking the question of how did this patient deteriorate? And they didn't know because the data wasn't there. And they had to make a determination in order to treat that patient. So they knew sickbay had been there and they rolled up the computer next to the bed. They were able to log in, and within under 2 minutes, they were able to diagnose as to why the patient had the event, and they were able to determine the correct treatment plan so that they could save that patient.